Good morning. We're here to give an update on COVID-19 in Oregon, and I'm joined this morning by a lot of people, all virtual. Rachel Banks, the Public Health Director at the Oregon Health Authority, Dave Baden, the Chief Financial Officer at the Oregon Health Authority, Dr. Dean Seidlinger, our state epidemiologist, Colt Gill, Director of the Oregon Department of Education, Wendy Watson, Kaiser Permanente Northwest Chief Operating Officer, Nicole Butler-Hooten, second grade teacher at Irving Elementary School and our 2021 Oregon Teacher of the Year, Mayra Pelayo, kindergarten teacher at Aiken Elementary School and Regional Teacher of the Year, and Yoselin Arenas Alvarez, a student at South Medford High School and a member of my Healthy Schools Reopening Council. I'm just going to cut to the chase this morning and start by addressing the topic of the past week, my decision to vaccinate Oregon's educators, school staff, and childcare providers. It's really pretty simple. I'm using every single tool we have to get our kids back into the classroom this school year. We are all aware that COVID-19 is a deadly disease. And while there have been some hopeful moments throughout the pandemic, overall, it's been really difficult for everyone, no matter how the past year has played out in your life. One group of people who are being deeply impacted by the pandemic are Oregon's kids. It deserves being said again, the long-term mental health, social, emotional, and academic impacts of our kids being out of the classroom are significant. I hear this from pediatricians. I hear it from teachers. I hear it from parents and families. But no one articulates the challenges of distance learning as well as the students themselves, which is why I've invited Yoselin Alvarez to join us today. Yoselin is a senior at South Medford High School. She's an incredible young woman and will be sharing her experiences with us today. A recent study by McKinsey showed that if schools remain remote, the potential educational loss could be substantial. This is especially true in mathematics, with students likely to lose 5 to 9 months on average of learning by the end of this school year. We also know that so many families have struggled to meet the demands of distance learning, with the impact disproportionately falling on working mothers. And we know that school is so much more than a place where kids go to learn. It provides social connection, meals, and other supports for our students. I want to be very, very clear. I have prioritized protecting seniors since day one of this response. And as a result, Oregon is faring better than nearly every other state in the nation in protecting our vulnerable seniors. Oregon has the second lowest COVID-19 infection rate among seniors in the country, and the third lowest death rate among people 65 and older. Just this past week, we completed first dose vaccinations for all seniors living in nursing homes and long-term care settings that wanted the vaccine. I first made the commitment at the end of last year to vaccinate Oregon's educators and school staff. I reaffirmed that commitment last week. Educators can be vaccinated quickly, district by district. This choice represents a rapid action that will have an outside impact on Oregon's kids. If we were to vaccinate every Oregon senior first, the unfortunate and harsh reality is that many of our educators would not get vaccinated this school year, and Oregon kids would continue to suffer. If we flip that and prioritize the needs of Oregon kids, it puts a 2-week delay on beginning vaccinations for seniors who live independently. We have been navigating this pandemic for almost a year. I am asking these seniors to hold tight and stay safe for just a few more weeks. I know so many Oregon grandparents are happy to do that in an effort to help get their grandchildren back into the classroom as quickly and as safely as possible. I'm proud we're doing everything we can to protect Oregonians, especially our most vulnerable. And I'm equally proud that we're doing everything we can to create the safest possible learning environments for our kids, school staff, and our educators. There's exponential value here too. For every teacher who's back in the classroom, they help 20, 30, 35 students get their life back on track. They help ensure 20, 30, 35 kids have access to mental health support. They make sure 20, 30, 35 kids get breakfast and lunch several days a week, and allow families to know their children are in good hands when they go to work. I know there will still be some who disagree with this choice. I also know there are many Oregonians who are eager to get the vaccine. The harsh reality is we are managing a scarce resource right now. I wish we had more vaccines to give. The foundation of my entire career has always been to fight for Oregon's kids, as an attorney, as a legislator, and as your governor. This choice I've made, backed by science, furthers that commitment. Time and time again, this pandemic has forced difficult choices. We are all doing our best. And even in tough times, I continue to be inspired by the extraordinary ways Oregonians lift one another up and work together. On that note, I will end with saying that we kicked off the legislative session this week, and it will certainly be a session unlike any in our lifetimes. No one in Oregon has ever conducted a legislative session with virtual committees and carefully planned floor sessions like this before. We are all governing in ways we had never imagined. I look forward to working with the legislature to pass a balanced budget, address the most pressing issues impacting Oregonians, and taking concrete steps toward building a more just and equitable Oregon for everyone. With that, I'm going to kick it to Director Rachel Banks to give an update on our vaccine efforts. Director Banks, over to you.
Thank you, Governor Brown. I'm Rachel Banks, Public Health Director at Oregon Health Authority, she, her, and hers, and I'm joined today by Dave Baden, our Chief Financial Officer. In recent weeks, Dave has stepped into the lead role overseeing the unified state response, coordinating the rollout of the COVID-19 vaccines. Dr. Dean Seidlinger is also here to answer your questions. Today, I want to give you an overview of the pandemic in Oregon and an update on the progress of our vaccination efforts. Then I want to give Dave a chance to walk through our projected timelines for vaccinating educators and seniors. As Governor Brown stated, we just don't have enough vaccines to immunize everyone who needs and wants a vaccination. And as long as supplies are scarce, we'll face really tough calls on who to immunize next. There are good reasons to prioritize educators, and good reasons to prioritize seniors, and good reasons to prioritize a number of other groups. However, as Dave's roadmap will show, the plan to vaccinate most educators before we start vaccinating seniors on February 8th. And if we want to give schools a chance at reopening this school year with a vaccinated staff, now is our time to do it. But before we get to the plan, let's take stock of our situation here in Oregon. Overall, new cases, hospitalizations, and our test positivity rate have all declined. Thank you, Oregonians. In terms of our case counts, as of today, we're adding 877 new cases of COVID-19 in Oregon. In total, there have been 136,839 reported cases of COVID-19 in Oregon to date. We reported 7,860 new cases during the week of Monday, January 11th through Sunday, January 17th, and that's a 4% decrease from the previous week. For the past 5 days, we've seen the lowest daily case counts since mid-November. Once again, thank you, Oregonians. Between January 13th and yesterday, the 7-day moving average of daily cases has declined from 1,308 to 828, and that represents a 37% drop. In the past week, Oregon is the third lowest state in the nation in new case rates. Thank you, Oregonians. And overall, since the start of the pandemic, Oregon has the fourth lowest case rate among all the states in the United States. In regard to hospitalizations from COVID-19, those are also declining from the peaks that we saw in late December. On January 1st, there were 466 people hospitalized with COVID-19. As of today, there are 317. In testing, we've seen a recent increase in testing. Clinicians administered 129,723 COVID-19 tests the week ending January 16th. And that increase was accompanied by a sharp drop in positive test results, which fell to 5.9%. This decline suggests we may continue to see lower numbers of new cases in the near-term future. However, and this is the part of the report that I hate the most, last week, Oregon recorded the highest number of weekly deaths since the beginning of the pandemic at 195. That grim number broke the previous record, which we recorded just the week before. And today we're reporting 22 more deaths, which means as of today, the toll of COVID-19 associated deaths in Oregon is 1,865. We know that deaths are a lagging indicator and they take a while to show up, but each of these deaths leaves a hole in the lives of friends, families, and neighbors. And we are devastated and so sorry about each and every loss. In terms of vaccinations, as of January 20th, just a month after the first COVID-19 vaccines arrived, I'm going to share with you where Oregon stands in our vaccination rollout. Oregon ranks 19th in the nation in the percentage of vaccines administered at 50%, and we rank 20th in the nation in the percentage of the population given at least one dose, and that's at 4.6%. Oregon has vaccinated 2/3 of those in the phase 1A group of healthcare workers, first responders, people who live or work in nursing homes, people with intellectual and developmental disabilities, and other groups. And that's about a week ahead of schedule. Over the past week, Oregon vaccinators met Governor Kate Brown's daily target of administering 12,000 doses per day, delivering a daily average of 12,289 shots. As of January 20th, Oregon vaccinators had administered a cumulative total of 253,711 first and second doses of COVID-19 vaccines. To date, 479,325 first and second doses of vaccine have been allocated to sites across Oregon. If you think about our vaccination efforts as a marathon, Oregon's vaccination program is roughly at the equivalent of the first mile. Over a handful of weeks, we've passed most states in the pace of our rollout, but we think it's misleading to judge any state's effort at this stage. Every state is grappling with the same fundamental problem, a shortage of vaccines. Every state is making hard choices about how to prioritize who is eligible to get vaccinated and how we distribute these scarce, precious resources. Across the nation, you may read that other states are already vaccinating seniors. Across the nation, you may read that other states are already vaccinating essential workers. And across the nation, you may read that other states are already vaccinating people with chronic conditions. Based on those reports, you might question, why is the speed of Oregon's rollout different? But it's not. Depending on the daily data fluctuations, the pace of Oregon's rollout is either in line with or ahead of most states. Every state receives a per capita allocation of vaccines. So when you read about other states throwing the doors open to all seniors or bus drivers or people with chronic health conditions, what's really happening is that those states are expanding the number of people eligible for vaccine on top of the same proportionately limited supply of doses that Oregon faces. In other words, they're layering more people in line for the same number of doses. They're doing that by either spending second doses for people who've received their first vaccination and putting people at risk of not getting a booster shot, or they're offering a promise of vaccine to more people than they can actually deliver one to. And as you may also have read, that's resulted in confusion, canceled appointments, and frustration. Let's talk about Oregon's roadmap. As you know, people who work in education, childcare, early learning are next up in Oregon. And I know that's controversial, but here are some of the very simple reasons to prioritize our educators next. If we want to reopen schools this year with a workforce of educators that has the confidence to re-enter a classroom knowing they're protected by a vaccine, now is really the time to act. As Dave Baden will explain in a minute, the size of the educator child care workforce is manageable enough that the supply of vaccines that we receive from the federal government is adequate enough to allow us to vaccinate most educators before February 8th, when we begin vaccinating seniors. If we waited to vaccinate educators after seniors, we wouldn't have enough doses of vaccine to finish vaccinating them until May. Again, the limited amount of doses forces states to make tough calls and hard choices. Seniors are absolutely a vulnerable population, along with many others who we deeply care about. And quickly vaccinating educators adds to the robust safety guidelines for schools and helps get students back into classrooms and parents back to work months sooner. We know that restarting schools mitigates the harsh educational and economic inequities that the pandemic has worsened for so many communities. And as Governor Brown stated, Oregon acted early in the pandemic response to protect our seniors in a variety of ways, which has led to these outcomes. Oregon has the second lowest COVID-19 infection rate among seniors in the nation, and the third lowest death rate among people 65 and older. Senior vaccinations are already underway. Pharmacies have already finished giving first doses for residents and staff at nursing facilities in Oregon. And Oregon will open vaccines to all seniors over a 4-week period, starting with people 80 and older on February 8th. So now I'm going to turn it over to Dave Baden, who took the lead role coordinating the state's unified vaccine response a couple weeks ago. He'll explain how we intend to vaccinate seniors and educators as quickly as possible based on our limited vaccine supplies.
Thank you, Director Banks. Let me walk you through our timelines, and let's pull up the first slide, please. So building on yesterday's total of 221,721 first doses administered, we expect to add another 30 to 40,000 first doses administered by the end of this week, before we begin vaccinating educators on January 25th. At that point, we will have vaccinated 67% of the Phase 1A workforce and long-term care residents. As we begin vaccinating educators, anyone we missed in Phase 1A will remain eligible for a vaccine. And over the next 2 weeks, we'll specifically reserve approximately 40,000 first doses for Phase 1A workers and long-term care residents. Going into early February, we'll have vaccinated approximately 72% of people in Phase 1A. Now let's talk about how we stage vaccinations for educators and seniors. Oregon receives a combination total of 50,000 first doses of Pfizer and Moderna vaccines per week. We have approximately 105,000 teachers and other K-12 school staff and 47,000 early learning and childcare staff who are eligible for a vaccine starting Monday, January 25th. To vaccinate that population, we will provide enough doses to administer 30,000 first doses the week of January 24th, reserving the remainder for people in Phase 1A, and 31,624 doses the week of January 31st, reserving the remainder for people in Phase 1A. And 25,000 first doses the week of February 7th, when 168,000 seniors who are 80 or older will become eligible. By the end of the first week that seniors are eligible, we have provided enough doses to vaccinate 57% of the educator workforce. And because of the organized partnerships between local public health departments and K-12 school districts, we expect the vast majority of the nearly 87,000 doses we project to deliver to educators over the next 3 weeks will be administered to K-12 school staff. We expect to have vaccinated a critical mass of seniors, about 78%, by the end of the first week of May. As Director Banks said, we could have taken a different path. We could have vaccinated seniors first, but because we can only count on 50,000 prime doses per week, in that scenario, we wouldn't reach a critical mass of educators until we were well into May. Now let's go to the next slide, please. Here's a spreadsheet that provides more detail. As you can see, in the next 2 weeks, we're vaccinating educators while we're still setting aside doses for the remainder of people who are unvaccinated from phase 1A groups. The week of February 7th, when people over 80 become eligible, we're assuming an even split of doses between educators and seniors. Again, as Director Banks said, under our approach, we expect all our vaccinators are reserving second doses for people who've received their prime shot. Keep that in mind when you hear people claim there are thousands of doses sitting on shelves in Oregon. Remember, we could provide more doses. We could provide doses to more people in these populations. We allocated all of our 100,000 total doses each week in that way. But we don't think that's responsible until we get further direction from CDC and the manufacturers to spend doses in that way. Let me emphasize, our timelines depend on the doses we receive from the federal government. If we receive more, we can move faster. If we receive less, we'll have no choice but to slow down. This morning, we did receive notice from the Federal Centers for Disease Control and Prevention that we could receive a 20 to 30% in our Moderna allocation. That increase isn't reflected in these timelines. And as we go over the next week, if that's true, we will increase our ability to move through educators and seniors faster. With that, let me turn it back over to Director Banks.
Thanks, Dave. I want to close by acknowledging how hard this pandemic has been on so many Oregonians. We've seen another downturn in cases and hospitalizations due to your hard work to wear masks, limit your social gatherings, and maintain physical distance. And for that, we thank you. This week, we learned that a new highly contagious variant of COVID-19, which was first discovered in the United Kingdom, has made its way to the US and now to Oregon. So we have to keep our guard up. We also learned that the new federal administration plans an aggressive effort to speed the production of vaccine. That's clearly welcome news. But when we get a major infusion of doses, we can't expect to see them until later this spring. Along with wearing masks, limiting indoor gatherings, and keeping physical distance away from others, the COVID vaccines are the safest and most effective way to stop the spread of the virus. Once most people in Oregon get vaccinated, we'll be that much closer to seeing our loved ones, celebrating holidays together, and getting back to a normal life. But we're simply not there yet. We're moving as fast as we can with the limited doses that we get, and we'll continue to keep you updated on our progress and let you know who's eligible and where you can get a vaccination. And with that, I'll turn it back to you, Governor Brown.
Thank you, Director Banks, and thank you, Dave, for joining us as well this morning. Next, I'm going to turn it over to Wendy Watson. She's the Chief Operating Officer at Kaiser Permanente Northwest, and she's going to talk about their, frankly, extraordinary collective efforts to get more Oregonians vaccinated. Wendy, it's all yours.
Thank you so much, Governor Brown. So I'm very excited that our 4-system community vaccination clinic at the Oregon Convention Center is now a reality. This is a collaboration across Kaiser Permanente, Providence, Legacy, and Oregon Health Sciences University. And it allows our 4 systems to come together to capitalize on our common vision to get all Oregonians vaccinated as rapidly as possible. So I'll start with just giving you an overview of the model at the Oregon Convention Center. To start with, this is a resource primarily for Tri-County, Multnomah, Clackamas, Washington. So when I provide some numbers, just keep that in mind because some of the state numbers are for all counties, and I'm going to cover the Tri-County area. So the Oregon Convention Center model is we will vaccinate in alignment with the prioritization as established by the state. We will get a certain allocation of doses each week, and we will use all of the first doses we receive each week and vaccinate. We aren't holding back surplus. We're going to vaccinate as much supply that comes our way. We're also doing all first and second doses. So as you heard, we will be reserving out the second dose supply to ensure that we can do that for everyone who receives their first dose. We've built this as a scheduled versus walk-in model. And the reason that we've done that is to ensure that we have a good match between the supply we have to work with each day on our vaccine doses and the number of people that we vaccinate. We don't want to have long lines or people frustrated and leaving without the ability to vaccinate. In order to manage that, we're partnering very closely with Oregon Health Authority, with local public health, and with the superintendents and educational service districts on making sure that we're coordinating on who we're providing those scheduling tickets to and getting scheduled into the convention center. We will run the convention center until we no longer need it. So we're building this as a sustainable model for, we're assuming, the next 6 to 9 months, and we're building it as a scalable model. We will ramp up as vaccine supply increases. By combining our resources across all 4 systems, by partnering up with the National Guard and volunteer agencies, we're able to ramp up those who can vaccinate as we get more supply. So let me give you a few updates on where we're at right now. So we did launch this week. On Wednesday, we vaccinated 1,365 people. Went very smoothly. We had representatives from all 4 systems there participating in that. On Saturday, we will be vaccinating 2,400 people. And in addition to all 4 systems, we have the National Guard and over 60 volunteers coming to participate in that with us. For next week, on Monday and Tuesday, we're partnering with Multnomah County to vaccinate a couple of vulnerable populations as part of Phase 1A. So the caregivers of medically fragile children living at home and adults living at home who require caregivers to come into the home to help them. We have 4,000 doses that we are administering over Monday and Tuesday in partnership with Multnomah County. Starting Wednesday, we will begin vaccinating the educators. We have 12,000 doses for next week for the educators and roughly 15,000 per week after that. As I said, we're coordinating closely with Educational Service District and superintendent leaders on how we allocate those doses to our educators to make sure that we're getting them through as rapidly as we can. We also next week have roughly 12,000 doses to continue vaccinating the Phase 1A population. And we will continue to partner with local public health, Oregon Health Authority, particularly in making sure we're getting to the vulnerable 1A patients and getting them vaccinated. Moving forward, we will continue partnering very closely with the governor, with Oregon Health Authority, with local public health. This is a very closely coordinated system because there just is not enough vaccine supply to meet the demand. I want to end with just acknowledgements of the leadership of all 4 systems that have come together and dedicated the resource, the time, and the commitment to make this a reality, and also all of the other people who have come forward and organizations to help us make this happen. National Guard, Governor's Office, volunteer agencies. This truly is an all hands together, coming together for the community. So Governor Brown, I'll turn it back over to you.
Thank you, Wendy, and thank you for your very detailed report out. We're incredibly grateful for our partners, including Kaiser Permanente Northwest, Legacy Health, Providence, and Oregon Health and Sciences University. With that, I'm going to turn it over to our educators. We have 2 teachers here with us today. The first is Nicole Butler-Hooten. She's a 2nd grade teacher at Irving Elementary School, and she is our 2021 Teacher of the Year. Nicole, the floor is yours.
Dela Shiushi, Nicole Butler-Hooten. I'm a 2nd grade teacher at Irving Elementary in Bethel, as Governor Brown said. I'm also a member of the Confederated Tribes of Siletz Indians, the Chetco Band, and the San Carlos Apache Tribe. Thank you, Governor Brown, for the difficult decisions that you are having to make. Thank you for having me today. As an elementary educator of 14 years, my heart lies within the professional career, and I strive to make connections that transcend the classroom every day. This year has been a year of firsts, resembling the newness of a first-year teacher. Learning to teach online, collaborate with colleagues, support families, engage students, focus on equity, and balance personal life has proved to be one of the most difficult endeavors of my teaching career, and I'm certain the feeling is echoed by teachers across the nation and those who have been thrust into the role of teachers, the parents and the caregivers. As a teacher who networks with many teachers across the state and prides herself on interpersonal relationship building, I've been able to witness and hear multiple stories regarding concerns of equity in distance learning and the desire for students to be back in person. Though the sentiments have varied from family to family, the main concern I hear is that many parents, caregivers, and guardians feel ill-equipped to teach their child, while also showing a great deal of concern about their child's social, emotional health and the feelings of isolation. I have heard pleas, stories of distress, and witnessed tears, and often those have been from my full-time working parents, my students of color, and those students with families with little support. When we step back and use our equity lens, it can become more clear that the students of color and the economically disadvantaged students may be more at risk. With my own children, ages 5 and 9, I've seen a roller coaster of emotion and many questions regarding if and when the coronavirus ends, will I get to see my friends, my teachers, and will school be back to normal? Since last March, when schools shut down, I have also heard concerns from colleagues, my friends, teachers, administrators, and parents about students' academic growth and their social emotional health. This has encouraged me to take a more active role in connecting with students, allowing them virtual playdates at the end of class, one-on-one check-ins, and encouraging parents to do Zoom lunch playdates and other safe experiences. But all these efforts are truly not the same as the feeling of seeing someone in person, in a physical space, arguably even with a mask on. If we can get our students safely back to school, we can physically assist them with meeting their educational needs and provide more academic consistency. My district has been strictly comprehensive distance learning since March, all online. And recently we brought back a few students in the upper grades for limited in person. Students and families have shown amazing resilience, perseverance, and flexibility with this model. Each day, parents and caregivers alike face new and difficult choices about how their child will return to school this year, whether or not they will attend in person, and how to best meet the needs of their child. I've had to coach and support, do socially distant home visits, and have daily communication with parents that has been very unique to distance learning. My own personal reflection is that it is critical for schools to open as safely and quickly as possible for in-person learning. The key word is safely. Many school staff are wanting to return only when school is safe, meaning when the vaccines are available and have had time to reach the full immunity of the 2 doses. I believe vaccinating school staff, along with looking at our high-risk populations, needs to be taken into account equally. When I see my second graders attend their daily Zoom meetings, which my next one starts in 30 minutes, I see them smile, laugh, engage, complete their online learning tasks. I'm reminded of their desire to learn, and learning is happening. That's not anything to argue with. But what I want to create space for is the families who are juggling time to be a teacher and a parent, the families who are unable to monitor and support their children, the students who are unable or afraid to unmute because of daily life taking place in their homes, students who have technology issues. I'm sort of becoming an expert on Zoom. Students who are struggling with their mental health needs and feelings of isolation. Our district has been presenting reopening plans for the last 3 weeks to staff. We've been following the Ready School Safe Learners guidance from the state. Last night at my district school board session, there was planning, collaboration, and clear plans in place for reopening. The intense planning on health and safety to make the transition as safe as possible has been really meaningful to staff. Approximately 2/3 of K-3 students in my district have completed parent surveys, and they would like to go back to hybrid. Many parents are speaking out, and there's quite a few that feel safe about returning. From my perspective, the most important thing to consider is that all students need access to a stable learning environment. Board members at last night's meeting in my district also expressed serious concerns about putting adults in jeopardy of contracting the COVID-19 virus. As a result, my district will hold off on beginning any in-person instruction until the teachers have had a chance to receive the vaccines. We are making the decision that is right for our community, and we hope that the vaccination can proceed quickly so that we can make the transition back to school. Schools play an important role in children's educational achievement, health, and well-being. Working with state, tribal, local, and territorial health officials, Schools can also play an important role in slowing the spread while ensuring that children have a safe and healthy learning environment. It is important for you to consider your family's unique needs and situations and the comfort level with the steps that your school is taking to reduce the spread of the COVID-19. Teachers, school staff, and representative organizations should all be actively involved and set out the policies for school reopening, looking at the guidance from the state. When we return to classrooms, it won't be business as usual. It will be a learning curve for us all. Lesson plans, assessments, and relationship building will all need to be adapted. I will definitely miss all the hugs, that's for sure. As I said before, my belief is that our students need to come back to school safely. I want to welcome them back, but no one should have to risk their health to make this a reality. I am grateful for the efforts that we've heard today. Thank you.
Thank you, Nicole, and thank you so much for being a transformational educator. With that, I'm going to turn it over to Mayra Pelayo. She is a kindergarten teacher at Aiken Elementary School, and she is our Regional Teacher of the Year. Take it away.
I apologize. Hi, my name is Mara Pelayo, and I am a kindergarten teacher in Ontario, Oregon. As Governor Brown said, I have been teaching kindergarten for 17 years. And for sure, this year, it has been different. So I'm going to be a little bit, so I don't repeat a lot of what Ms. Nicole Butler just said, because we both are teachers and we both have such a same beliefs of what she was saying. I'm going to try to outline a little bit, just saying thank you to everybody for working with this pandemic with us. I am grateful that teachers are next in line for the COVID vaccine. We are just full of emotions. We know everybody needs those vaccines, but we really want our schools to open and all the teachers to be protected, because at the end, we are parents, we are mothers, we are daughters, and we have kids, and we want to be safe too. But we really wanted to be protected, and we are desperately to get back in our classrooms. Our goal is hopefully of getting students back in the classroom as soon as possible, because some of our students are falling behind online. And it's sad. It's sad to see it, especially with our color students. It's especially for little kids. It's very sad to see. It's very sad to see them, how low they're getting and how hard it is going to be for them to catch up. So you guys give us the opportunity, and we are asking to support us. I know teachers to get the vaccine, but we really wanted it, because the virtual learning may be keeping the students and their families safe. But during this pandemic right now, it has been so hard for them to keep them motivated, to keep them learning. Plus, not only their motivation, but the lack of social and emotional and academic is very, very low. So we can wait for our schools to open, and hopefully we can return to school safe. So please, we are asking to support us. Thank you to our governor for supporting the teachers and continue helping us. And also to all the teachers, that it's amazing. It's just amazing the hard work that they're doing for our kids during this pandemic. So please give us all your support, not only to us, but also for the kids, because the kids we're doing this for the kids, and the kids are our future. So thank you so much. And thank you for everybody's support.
Thank you. Thanks so much for joining us. Thanks for being a kindergarten teacher, and we wish you the best. We're glad you were able to join us from Ontario. So last but not least, I want to turn it over to one of our students. Yaslin has been serving on my Healthy Schools Reopening Council. She is a senior this year, and she attends South Medford High School. And I just really appreciate her willingness to speak out this morning. Yaslin, the floor is yours.
Hi there. It's so nice to see all of you guys. Speak to all of you guys on my behalf. As Governor Brown said, I am a senior at South Medford High School, and I'm also the ASB president. So I'm able to interact with our peers and our students a lot and hear their opinions. I actually wrote something that really reflected on a lot of the comments I've received and ways I've felt during this pandemic as well. So let me go ahead and read it. Wake up, stare at the ceiling, and wait. Maybe if I just close my eyes for a second, everything will go back to normal. This has been the morning routine for many kids this past year. Some of us are frustrated, tired, and lack motivation to open our computers. Some of us have taken on extra work shifts to support our families due to some of our parents losing their jobs. Some of us have found our way of learning and are exceeding under distance learning. Some of us have lost loved ones. Some of us have been living in an abusive household. And some of us don't even have a place to call home. Over this past year, I have been astonished to hear more of my peers come to me and say, I just can't do it anymore. I just can't. I can't even wake up to attend a class. What makes me think I can even graduate? And even if I did, would I even be prepared to go to college? These students range from those who were once on track to graduate to those who continuously were fighting to be on track to graduate. I keep telling them 1 more year. We have 1 more year. Yet some days, I think that 1 year feels longer than all 3 years of high school combined. Yet some of our students, some of our students want to go back. They do. And many of us have come to the conclusion that going back is like baking a cake. There are many steps to take. And if you don't follow the ingredients and the instructions, you might just end up with a loaf of bread. As a student, we are energized by the extracurriculars, random spirit weeks, and the presence of our peers. Some of us are simply happy to be away from home, to have a break, just a little break. However, we understand that going back will look different than all of that. There will be no rallies, no group huddles, and there will be limited extracurriculars. But we will have warm lunches, a desk, shelter, and most importantly, each other. As many other students, I ponder the thought of opening and the safety for our staff, administration, and teachers. I think about the people that have cared for me, taught me, and supported me throughout my life. Whether that be my middle school teachers or the amazing custodians that roam the hallways. Yes, losing a student, teacher, staff, admin, or a family member to suicide is truly devastating, but so is losing them to COVID. This past year, I have worked on the Healthy Schools Reopening Committee and my local district task force to help figure out a way to return students, staff, teachers, and admin with safety and efficiency. And ultimately, I want to leave with you guys with this. Please, as the amazing Oregon as I know you to be, can we come together and can we make a cake and not a loaf of bread? Can we take the instructions, the ingredients, and make sure that if we do go back, we make it the best way we can and we don't rush it and we end up making a loaf of bread because people like cake. And that's what I have to say on my behalf and the behalf of students in Oregon. Thank you so much for listening and tuning in, and I turn it back to Governor Brown.
Thank you, Yoselin. Thank you so much for your very eloquent words. And we're going to do everything we can, provide every tool we can to work at getting our students back into the classroom, including your peers. And I wish you the best in your college search. So with that, Charles, I think we're ready for questions.
Thank you, Governor. Thanks everyone for joining today. We have time for just a few questions, so we're going to get right to it with Gary Warner from EO Media. Go ahead, Gary.
Hi, Governor. Can you tell us if you have any modeling or quantification of the number of seniors or people in general who potentially could die during the 2 weeks that you are halting, that you're pushing back the senior inoculations for the teachers?
Thank you, Gary. The harsh reality is that we do not have enough vaccines. There are no easy answers here, only difficult decisions. And I want to be very, very clear that my priorities have not changed. Only my timeline has. I'm absolutely committed to keeping our seniors safe. That's why we worked very hard and very efficiently to make sure that every single senior living in an assisted living home or in a nursing home got a vaccine. We completed that this past week. And with that, I'm going to turn it over to Dr. Seidlinger to provide detailed numbers.
Thank you, Governor Brown. Thank you, Gary, for that question. We don't have specific modeling that looks at the impact on seniors of delaying vaccine till after educators. But what we do know is, as Governor Brown stated, we've provided vaccines into our skilled nursing facilities and other congregate facilities and offered that first vaccine to individuals in those settings. Tragically, more than 50% of our deaths here in Oregon have come in those settings. And these are some of our most vulnerable residents in some of the most vulnerable situations. We do continue to monitor the cases. And as Director Banks said, we've seen cases go down in the last week, and that's due to the hard work of all Oregonians. We can continue to drive case rates down, continue to drive hospitalizations down, and continue to prevent deaths with the masks that we have to wear, with limiting our social gathering and keeping our distance for a few more weeks. Seniors are getting the vaccine in congregate facilities first, and seniors in the rest of Oregon will be getting the vaccines as well. These are, as the governor stated, there are no easy answers, just difficult choices. And with our situation where we are, with cases going down, the tools that we have in hand, and the vaccine supply continuing to come in week over week, these choices and these phases we've made will protect as many Oregonians as we can.
I still don't understand the split off on going in and inoculating the people in the congregate care facilities, because about 50% of the deaths nationwide even are in those facilities. Yet you also have statistics that show the large percentage of elderly who make up the people who are dying because of COVID, and why that isn't also a percentage that needs to be dealt with before we start thinking about things like teachers or essential workers.
So Gary, go ahead, Dean, if you want to take that one, that's fine.
Yeah, I think when we look at the prioritization, again, these decisions in Oregon follow along from the federal framework. The National Academy of Sciences came together and looked at ethical frameworks and equitable frameworks for distributing a scarce resource like COVID vaccine. There aren't enough vaccines for everyone to get it at once, and there are many deserving groups, from preventing spread more broadly to protecting critical workers, to protecting workers who continue to work and come into work who couldn't work from home to make sure we had food on the table, to our students who need to have access to their teachers and who can do some through remote learning, but not all, to our seniors, to our communities of color, to our Native American neighbors, those last three groups who've been more impacted by this disease. Not everyone can be in the same place in line. And so making choices as we look at how the disease is spreading here in Oregon, where we can have the biggest impact on preventing disease, preventing hospitalization, and preventing deaths, means that we have to do multiple things at once. We vaccinated those seniors and other residents in congregate facilities along with staff and healthcare staff who provide critical care to all Oregonians. We are vaccinating teachers. We are vaccinating seniors, and those are coming up in the coming weeks. And our vaccine advisory committee is helping us to prioritize amongst the following groups, all of whom are deserving the vaccine, but how do we make the biggest impact in Oregon? And I'll turn it back to Governor Brown.
Thank you. The only thing I would add, Gary, is that it's absolutely true that our children are not dying from COVID at the same rate as members of the Latino, Latina, Latinx community, as members of the African American community, as members of the tribal community, and as seniors. But what is true is that our children are suffering. I've talked to physicians and parents. I know that kids across the state are struggling with anxiety and depression. I know that a number of kids have attempted suicide. And we know that education provides not only the nuts and bolts of the education, but it provides social and emotional support. As Yaselin very eloquently mentioned, just hanging out with peers provides a lot of support for a number of teenagers. So we know that if we put the educator workforce in the pipeline now, we will be able to get our children back into the classroom before the school year ends. I'm committed to throwing every single tool that I have to getting our kids back into the classroom this year. And that includes vaccines.
I'll let my other colleagues move along and take the next questions, but I still didn't hear an answer to the death versus difficulties question.
Thanks, Gary. We're going to let a few more folks ask questions. So we'll go next to John Hendricks from KPDV. Go ahead, John.
Thank you for taking the time to answer our questions. Now, when does the state expect to get through phase one compared to other timelines that had been released? How does this timeline differ? Also, the state is working to get schools open. What progress is being made to open other businesses and lift some of these restrictions?
So I'd like to turn it over to Dave Baden to talk about the timelines with the 1A population. Dave, would you please take the mic on that?
Right. Thank you, Governor. So the vaccines to date have really been focused on those phase 1A populations. And we continue to provide over 12,000 doses per day into those populations. So, based on how many Oregonians that have received vaccine, and again, that's around 221,000 as of a couple of days ago. We estimate that in the next week or so, based on current rates of vaccine, that we should be over 300,000 first doses provided. So that's really 2/3, or actually 3/4 of that estimated phase 1A population will have been vaccinated right as we're turning to educators. Governor, back to you for the other piece.
Thank you, Dave. I think, John, your next question was how quickly and what are we doing to open up our businesses that have taken the extra mile, honestly, and very willingly complied with safety protocol in order to keep their customers and clients safe, in order to keep Oregonians safe, and to reduce the spread of the disease. I'm going to turn it over to Dr. Seidlinger to talk about the numbers, or Director Banks to talk about the numbers. But here's what I do know. Oregon, throughout this pandemic, because Oregonians have been willing to make tremendous sacrifices and wear masks, to socially distance, to limit social gatherings, and really limit their social and community interactions, we have continued to maintain one of the lowest infection rates in the country. And the good news is that we are continuing to see either a plateau or a decline in cases because Oregonians have made these tremendous sacrifices. My goal, and it's really up to each community, and that's why we created the new set of metrics. As community members continue to make sacrifices, the infection rates go down and businesses can continue to open. And the more that we all make these tremendous sacrifices, the sooner we're going to be able to open our favorite restaurants or favorite bars. And of course, I know lots of Oregonians want to get to the gym to work out. Dr. Seidlinger, Director Banks, do you want to talk a little bit about numbers in terms of counties and where we're at?
Sure, Governor Brown. This is Dean Seidlinger. I think what we've seen, as the governor mentioned, with the county risk over framework that she implemented in November in response to our surge, we have a framework for moving forward as we vaccinate Oregonians. What we saw this week, which is a warning week, so we pull data and let counties know where they would be if they were moving this week, is that two counties would have moved down in risk level. So they're seeing less cases, enough to be able to move into a less restrictive area. Unfortunately, 3 counties would have moved up. But what we've also seen, as Director Banks laid out, is that cases in Oregon continue to decline, with us seeing our daily rates going down to where they were in November. This is thanks to all of the actions that Oregonians have taken. The power is in your hands. The power is in your mask. Wearing a mask, limiting your gathering sizes indoors, and keeping your physical distance is what allows those case rates to come down. And so as Oregonians come together, we'll continue to pull that data week by week. And I think we will see over the next few weeks that as Oregonians continue to follow this advice, to do what they've been doing for the last year, that we'll see more counties be able to move into a lower risk level, see more activities be able to be resumed in a safer fashion, and see a semblance of normalcy come back to us as we move through 2021.
Thanks, John. We have time for another question from Lisa Balick from COIN. Go ahead, Lisa.
Yes, thanks, Governor. When it comes to giving out the shots to teachers and other educators, why not at least require a school district to have a signed agreement with their teachers union that their teachers agree to go back this year if vaccinated?
Thank you, Lisa. As I said earlier, I'm absolutely committed to making sure that we are using every single tool in the toolbox to get our kids back into the classroom before the end of the school year. I've had conversations with superintendents and with educators across the state. I am confident that we are providing our educator workforce with everything that they have asked for in order to safely return to the classroom. For example, educators have asked me for additional resources. With the assistance of the federal government, we are providing nearly $500 million to ensure that every single school district has the resources it needs to purchase safety equipment and any tools that they need to increase and ensure compliance with rigorous safety protocol. Secondly, educators have asked to make sure that they get vaccinated. We're working hard as quickly and as efficiently as we can to make that happen. And of course, we're working and continuing to work to make sure that school districts are in compliance with this rigorous safety protocol. Director Gill, do you want to respond, add any information?
All right, thank you, Governor. I think that was great. And just a couple of things to add is that we do have school districts in deep planning with their educators and with their communities all over the state of Oregon. So we have school districts that are looking at their metrics with about 21 of our counties either able to meet the metrics for the advisory metrics for returning to in-person instruction at elementary or throughout the kindergarten and through 12th grade continuum. Those discussions are all about doing that as safely as possible, following the guidelines in our Ready School Safe Learners guidance that include over 160 requirements to build the cake that Yoselin was talking about. Those all need to be followed, and that's a group effort to make that happen in each community. Those discussions are underway, and we see school districts opening from Eastern Oregon to Western Oregon and from Southern Oregon to the coast and up and down the I-5 corridor. So I think that is underway. I think that we see those agreements in place across the state, and we see the system beginning to understand the power of these tools that we put in place, from the testing to the requirements in our schools for physical distancing and face coverings and entry screening, and to this last one, the vaccine being another additional tool to open our schools. The governor has really given us the resources we need to make this happen.
But why not a promise to go back if you get a shot?
Look, I'm confident that our educator workforce, with the assistance of vaccines, with the testing that we have in reserve to ensure that rapid buy next now tests are available, and the additional resources, and the partnerships, frankly, between the administration and the educator workforce, I'm confident that we can make this happen. So that concludes our program today. Thank you all so much. Please stay safe. Please continue to wear your mask, watch your hands, watch your physical distancing, and take care.